the Centers for Disease Control and Prevention, CDC, published a memo outlining significant changes to the US childhood vaccine schedule to align with those of other nations. It enables freedom of choice rather than mandates. Critics claim this change will cause increased disease risk and hospitalizations. The new schedule reduces the number of universally recommended vaccines from 17 to 11. Vaccines are now categorized as universal, high risk, or shared decision. Importantly, insurance coverage remains in place for all the vaccines, which are all still available. 11 vaccines remain universally recommended, including MMR and polio. 6 vaccines, such as hepatitis A and B, have been reclassified but not eliminated. The memo aims to align the US with global standards, reduce dose burden, and enhance public trust and freedom of choice. The CDC published a chart showing that the US, with 17 vaccine recommendations and 12 mandates, 17-12, had the highest number of recommendations and mandates worldwide. A comparison of the US with 20 countries shows the new schedule aims to align with international practices, reducing the number of recommended vaccines to improve adherence. The decision memo highlights that simpler schedules in peer nations achieve effective disease prevention. However, it lacks new safety data and does not claim that reclassified vaccines are unsafe. The focus is on informed consent and public trust. The American Academy of Pediatrics opposes the changes and maintains the prior vaccination recommendations. Concerns include potential increases in hospitalizations and the re-emergence of diseases like hepatitis A. However, the new schedule aims to simplify and align with international practices, potentially boosting adherence and confidence, but it does not deny anyone access to any vaccine. Key takeaways include the continued availability and funding of all vaccines. The policy shift aims to provide choice rather than mandates, with the impact dependent on family and clinician behavior. Critics focus on mandates that would affect school admission and employment rather than freedom of choice by the patient and their doctor.